Hello there. It is my pleasure to provide you some practical information to help you through your head and neck surgical procedure. It is completely normal to feel nervous about the unknown. Together, we will explore how to best prepare, what to expect, as well as the best way to become involved in your recovery of your upcoming surgery. All information presented is recommended and supported by a critical review of the medical literature, including the recent recovery pathway called ERAS, standing for Enhanced Recovery After Surgery. When compared with traditional operative care, using aspects of ERAS has been associated with decreased pain and length of stay, while simultaneously improving patient satisfaction and quality of life, thus enabling you to recover more quickly and resume routine activities in a more timely fashion compared to standard surgical care. Benefits have been reported for patients undergoing head and neck procedures. Please keep in mind that this guide is meant to be a general overview of the type of surgery you may be having. The details and extent of your surgery will depend on the type of cancer you have and its specific location and size. A surgery is something that is best approached when one is prepared and takes the appropriate measures to recover from such a physically and mentally draining day. You should spend the time before the procedure being as active as you can, whether that involves going for short walks or exercising, having a well-balanced diet, and getting appropriate amount of sleep. If you smoke or drink alcohol, you'd benefit to stop as soon as possible because smoking can cause problems with breathing, wound healing, and overall recovery from surgery, and stopping alcohol consumption reduces post-operative complication rates. The surgery you'll be having is called a transoral robotic surgery, or TORS, which is a minimally invasive procedure in which a series of robot arms are used in order to reach the tumor through the mouth and resect it. It's most commonly used for tumors in the throat, particularly located in the tonsils or the tongue. Because it is minimally invasive, TORS allows the surgeon to avoid large incisions in the neck and mouth in order to reach the difficult area of the tumor. Furthermore, TORS can reduce the need for additional therapy, as often the goal is to reduce the amount of radiation you may need post-surgery, while some patients can even avoid radiation and chemotherapy altogether. It is important to note that some surgeons may perform a neck dissection during the same surgery if it is indicated as part of your treatment. Although this may vary depending on your healthcare team, ERAS recommends taking the following steps before your surgery. The recommended pathway allows consumption of solid foods up to 6 hours prior to surgery and clear liquids up to 3 hours prior. You can drink clear liquids such as water, black tea, black coffee, or apple juice up to 3 hours leading to surgery, but no liquids such as milk or orange juice are allowed. Before surgery, patients should shower or bathe, full body, in 4% chlorhexidine gluconate soap at least the night before, and ideally also the morning of the operative day, as it has been associated with a lower risk of surgical site infections for patients undergoing head and neck surgeries. Hair in the operative field should be clipped, not shaved, while skin is clean to avoid any cuts or irritation. The day of the surgery. Try to bring a family member, friend, or someone to assist you. You won't be allowed to drive after outpatient surgery, or even after a few days in the hospital, primarily if you're taking pain medication. Plan to have someone take you home. Wear comfortable clothing. Wear or bring loose-fitting clothing. Your body might be sore or swollen from surgery, or you may have bulky bandages over your incisions. Leave jewelry and valuables at home. You can bring toothpaste, a toothbrush, pajamas, denture cup if necessary, and any medications that you take regularly in a labeled pharmacy container approved by your healthcare provider. You may also choose to bring compression stockings to wear on your journey home. On the day of the surgery, the healthcare provider who will admit you will likely check your temperature, blood pressure, pulse, and breathing, review your medications, and help you get ready. You will receive some medications before and after surgery to improve pain control. Frequently, an intravenous tube, called an IV, will be placed into a vein in your arm to allow you to get fluids and medication. When you are ready, someone will help you onto a stretcher and take you to the holding area and then to the operating room. During your hospital stay, post-operative ERAS elements typically focus on pain management, bowel function, diet, and patient mobilization. Criteria for discharge for any patient undergoing head and neck surgery include airway safety, tolerance of their diet, ambulation, ability to go to the bathroom, and appropriate pain control. Airway and breathing. A tracheostomy tube may be placed during your surgery if your surgeon believes that your airway may be at risk during or after the surgery due to swelling or other reasons. A tracheostomy tube is a small tube placed in the neck to the trachea, which will allow you to breathe by bypassing the oral and nasal cavity. ERAS promotes rationalization of the use of tracheostomies, which ensures that routine placement of tracheostomy tubes no longer occurs. In the case that you do need a tracheostomy tube, cuff deflation, taking down the cuff to allow more air to pass through, and decannulation, removal of the tube, will occur as soon as possible after the surgery. Sometimes your tube will be switched for a smaller size after a few days to allow more air to go up to your nasal and oral cavities. If this is tolerated well, there is a trial of corking, which means the tracheostomy tube will be corked shut for 12 to 24 hours. If this goes well, it means that the tube is no longer necessary and can be removed. A special tape will be placed over the area to allow it to heal. It is important that you press down on this tape every time you speak or cough in order to minimize air leaking and allow a quicker healing process. Regardless of whether or not you receive a tracheostomy, your throat may feel sore from the tube used to help you breathe during surgery. Following your operation, when you wake up, it is important that you perform deep breathing exercises. Breathe in deeply through your nose and relax the air out through your mouth. Undertake this at least 5 times an hour. Speech. Depending on the precise area of your tumor and the extent of surgery, it is possible that your speech will be affected immediately post-operatively. If this is the case, you will be assessed and followed by a speech-language pathologist who will help optimize your speech by various techniques and exercises. Swallowing. As you may have some difficulty swallowing after your surgery, feeding might be started through a nasogastric tube which runs through your nose to the stomach. You'll be assessed by a speech-language pathologist who will help decide when it is safe to start drinking water and slowly progress your diet using safe textures and swallowing exercises. It is possible that your surgery will cause a prolonged phase of inability to swallow, in which case a percutaneous endoscopic gastrostomy, or a PEG tube, will be inserted from your abdomen to your stomach to allow feeds to bypass the upper GI tract. It is possible you're discharged home with this tube until you can resume eating again. Mobilization. The medical staff may help you get out of bed after your operation. You should try to spend up to 2 hours out of bed on the day of your operation. If you feel faint or dizzy, call the nurse to help you get back to bed. On each day after your surgery, it is advised that, provided you feel well enough, you sit in the chair for a total of 6 hours, with intermittent rests on the bed as needed. Your medical team will place compression stockings and give you medication in order to decrease the chance of blood clots in your legs while you're lying in bed. However, your aim should be to get out of bed and walk along the ward corridor as much as possible to return to your baseline physical activity. Sutures and clips. Incisions on the head and neck are typically closed with sutures or clips. If they are non-resorbable, they will be removed by your doctor or nurse between the post-operative day 10 to 14, unless they are on the face, in which case they may be removed after 5 to 7 days to reduce scar formation. All incisions and sutures are strategically placed to minimize scars, and incisions are made inside the oral cavity rather than skin whenever possible. You may help further reduce scars by placing polysporin or vitamin E ointment and massaging the incision 3 to 4 times a day after sutures and clips have been removed. It is important to avoid sunlight and tanning for several weeks to months after your surgery, as UV rays during the healing process can make the scar more permanent and noticeable. Mood. Feeling stiff or achy is also normal at this time. These feelings will go away when you can move around more. Some patients feel sad or blue after surgery. These feelings are normal. As your body heals and you're able to resume your activities, these feelings will lessen. Please talk about these feelings with your nurse, a friend, or someone in your family. If you feel overwhelmed by these feelings or they do not lessen over time, please get help from a healthcare provider. It is worthwhile in advance to plan for your discharge. You may require someone to help you for a few weeks. Although it is not indispensable, some people feel more confident to go home with a friend or a family member if they can stay with them for a short period of time. Post-hospital recovery. Soreness and pain. It is not unusual to suffer pains around your surgical sites during the first week following surgery. The pain usually lasts for several minutes and goes away between the spasms. If you have severe pain or have a fever and feel generally unwell within 2 weeks of your operation date, you should immediately contact a healthcare provider. Your wound. It is not unusual for your wounds to be slightly red and uncomfortable during the first 1 or 2 weeks. You may start to take showers 3 days after your surgery. Let the water run over your wounds and do not rub them, only pat them dry. If you have staples or clips in your incision, you will get an appointment to remove them 7 to 14 days after your surgery. Please contact a healthcare provider if your wounds become inflamed, painful, swollen, or start to discharge fluid. Diet. You'll receive a specific diet plan by your nutritionist and/or speech-language pathologist before leaving the hospital if necessary. You may need to stick to certain textures or consistencies for a while before your follow-up appointment. A balanced, varied diet is recommended. You may find that some foods upset you or cause loose bowel motions. If this is the case, you should avoid these foods for the first few weeks following your surgery. If you're finding it difficult to eat, it is still important to obtain an adequate amount of protein to help your body heal. If you're suffering from diarrhea, it is important to replace the fluid loss and to drink extra fluids. Exercise. Walking is usually encouraged starting the day following your operation. You should plan to undertake regular exercise several times a day and gradually increase this during the 4 weeks following your operation until you're back to your normal level of activity. The main restriction on exercise is usually to not undertake heavy lifting, generally no more than 5 to 10 pounds, and contact sports until 6 weeks following your surgery. In addition, if you're planning to restart a routine exercise such as jogging or swimming, you should usually wait until at least 2 weeks after discharge from hospital and start gradually. Common sense will guide your exercise and rehabilitation. In general, if the wound is still uncomfortable, modify your exercise. Once the wounds have completely healed, you can normally undertake most activities. Driving. You should not drive until you're confident that you can drive safely. Usually this will be within 2 to 4 weeks of surgery. It is important that any pain has resolved sufficiently, that you are able to completely mobilize your neck in order to look behind you in both directions, and that you're not taking any medication that would interfere with your ability to react appropriately in the event of an emergency on the road. Hobbies and activities. You should consider taking up your hobbies and activities as soon as possible again after surgery. This enables you to maintain your activity and will benefit your recovery. You should not need to restrict these unless they cause significant pain or involve heavy lifting. Tiredness. It is frequent to feel low energy levels following surgery and anesthesia. It is important to mix activities with some rest as needed, but to get out of bed each day and get dressed if possible. In summary, to enhance your recovery, you will benefit to return gradually to normal as quickly as possible. This means that you need to actively participate in your recovery by walking, eating, and drinking. Each day, you should feel some improvement, but do ask your healthcare provider if you're worried about something. You can refer to the list of products for your specific surgery on precare.ca as an example on what you need for your surgical preparation and recovery. It is our hope that this video makes you feel more confident about what's ahead. On behalf of the Precare team, we wish you the best on your journey.